This is your first rehab assignment. This is a patient with patellofemoral pain. Brittany is the patient for the day. She's a 23-year-old rower who's having pain on the front of her knee. Brittany, have you ever done rehabilitation before?
No.
We'll try to make it pretty harmless and painless today. First, I'll do a bit of an examination, and then we'll start some of the rehabilitation exercises after that.
Okay.
To start off, why don't you just tell me about your pain? When did it start?
I started noticing about a week and a half ago. It was just during weights initially, and then we've been on the erg a lot for rowing practice. And so it started about a week ago being a little bit sore during practice. And so since then I've been trying to work through it, but it hasn't gotten any better.
What kind of lifts seem to make it worse?
Squats, lunges, step-ups with weight.
Are you still able to do all your same weights, your same previous weights, or have you had to cut back on the amount of weight?
I was going to talk to Coach this afternoon about cutting back because it's pretty sore.
Okay. Any treatments at all to this point?
I've taken some ibuprofen. My mom told me to take some, so.
Does that help at all?
I guess a little bit, but then when I take it, I'm done with practice, so.
I guess that makes sense. Any ice, anything else?
Uh,
Okay. And have you missed any sessions? Have you been able to do all your lifting sessions and all your rowing up to this point?
Yeah, it's been uncomfortable, and it's hard to take time off, so.
Well, you guys are in the winter part now, right? Don't you have Saturdays and Sundays off?
Yeah, this last weekend we had off, so out of season.
Does that make any difference?
It felt better Sunday night and Monday.
Okay.
Did feel better.
Okay. Never had this problem before?
No.
Right. Have you ever had this problem on your left side?
No.
Okay. Let's stop. Okay, and now we'll start the examination part so you have some information to build your rehabilitation case on. First, what I think we should do is just look at Brittany's alignment. Just observation first. And so what you can see from her standing alignment is her right foot is a little bit more pronated than the left, although they're both pronated. That means that her feet roll in. Okay. Her knees are pretty well aligned. This one might point in just a little bit, perhaps more than the left, but in just a little bit. Otherwise, her leg lengths look equal. They feel equal if I palpate her pelvic landmarks. That looks good. Brittany, will you face that way? From this angle, then, of course, we can look for hyperextension of her knees or standing with knees flexed. If anything, her knees look a little hyperextensible, but not bad. Other than that, I don't see much from this position. Let's come back to the table. If we observe in this position now, you'll see she has good thigh size and tone. Looks like this leg could be a little bit more genu valgum on this side, so her knee might come in a little bit more on the right than on the left. That would predispose somebody to have pain on the front of their knee. Otherwise, no acute swelling, no obvious deformity. Next, I'm going to do palpation. I'll find the inside and outside borders of her kneecap. They're about like that, so it looks like her kneecap sits a little laterally tilted. If I find her medial and lateral femoral condyles, I would say her kneecap's pretty well centered between her medial and lateral femoral condyles. Okay. I don't feel any warmth to touch. I'm doing a ballottement test now, trying to see if she has any effusion, any swelling in her joint. Yes, she does. So she has mild swelling in her joint. That can be confirmed by brush test. And again, for the purpose of this case, it looks like she has some mild effusion inside her joint. Okay. I'm going to check knee extension, range of motion next. So observation, palpation, range of motion. Knee extension range looks pretty good. Perhaps similar to what we saw in standing, she has a bit of hyperextension on her right side. More so than the left. How about knee bending? Can you bring your heel to your bottom? So that's her active range of motion, and then she just gave herself some passive range of motion. Does that bother at all?
Just a little sore, but not.
So clearly that's full range of motion, and as you'd expect with a little bit of swelling in her joint, that could be a little bit painful at the very end range. We do the same thing on this side. Alright, so essentially that's equal. It might be slightly more on the left side, but certainly within normal on this side. Come on out. Okay, let's come back a little bit so your heels are on the table. Alright, if I start pushing around now, I'm going to push here first. This is the inferior pole of her patella. Does that bother at all? Patellar tendon. Tibial tuberosity. No, nothing. Superior pole of her patella.
It's okay.
Still okay. Medial border.
It's a little sore.
So some mild tenderness on the medial border. Medial patellofemoral ligament. No. Lateral border.
Yeah, that's where it's sore.
How about here?
Yeah.
So lateral border for patella and then lateral patellofemoral ligament are painful. That's just straight patellar compression. Does that bother?
Mm-hmm.
Any problem there?
Not really. It's a little sore when you push in.
Okay, just because where my fingers are.
I think so.
Okay, so patellar compression and patellar mobilization are not painful. Only when I touch the lateral border of her patella is that sore. Okay, will you tighten your thigh muscle, please? So do a quad set. And relax. And tighten again. And relax. So a couple things to look for here. You're trying to look for a good vastus medialis tone. Go ahead and fire. That looks pretty good. She has a very impressive vastus lateralis, of course, but the vastus medialis looks pretty good. That's the first thing to check. Relax. Tighten again. Looking for the way her patella tracks. It tracks pretty centrally, straight up and down. And relax. And then go ahead one more time, Brittany. And then the other thing I look for is does she have enough quad strength to be able to lift her heel against gravity? Looks like she does, and she is up at end range. So, okay, very good. Why don't you go ahead and lie back, please? I'm going to confirm the flexion range. Looks good. I usually do hamstring length next. That starts to feel a little bit tight. Well, probably about 65 degrees or so of elevation. That's pretty similar to the opposite side. Might be just slightly more on this side, but pretty similar. Keep doing a bit of a flexibility examination. Looks like she has just a little bit of tightness on the back side of her hip. So the structures that would attach to her IT band looks a little bit tight. I'll check the opposite side here in a second. Okay, Brittany, will you hold right there real strong, please? Don't let me push down. Hold very strong. Hold real strong up here. Hold. Good, good. So hip strength looks good. Hip flexion strength. Relax for me for a second. And now hold there again. And this is kind of a cheap way to test quad strength. Hold strong. Is that sore at all?
A little bit.
Okay.
Yeah.
And relax. Lift up on the left side, please. With your knee straight. Good. Hold real strong. Real strong. Again, I would say hip flexion strength is 5 out of 5. Hold right there, please. Don't let me push down. And wow, now quad strength on this side, definitely 5 out of 5. Well done. Rely on your left side, please, facing that way. I'm going to test her hip abductor strength. Okay, hold right there, very strong. Don't let me push down. Come on, Brittany, hold, hold, hold. Oh boy. I'll give you a second chance. Come on up. Hold right there, real strong. You got it? Don't let me push down. Come on, hold, 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 hold. Okay, so clearly weak there, what I'd call probably 4+ out of 5. Rely on your right side, please. Let's do the same test on this side. And hold right there, very strong. Don't let me push down, hold strong. Strong, real strong. Not bad, definitely stronger than the right side. Let's try that one more time, hold very strong. Yeah, almost normal, and clearly more than the right side. Go ahead and lie on your back. Put your right leg down, please. While I have you here, I'll check your flexibility on the back of this hip. I would say that tightness is pretty similar side to side. So I'm just checking how much she can kind of bring her knee up to her opposite shoulder. Okay, why don't you flip onto your belly, please? Remember the right leg was the involved leg, so let's do right hip extension. Go ahead and lift your a little higher if you can. Perfect. Hold very strong. Don't let me push down. Real strong. Hold. Hold. Excellent. That's perfect. Well done. Lift up on your left side. Hold very strong. Great. That was excellent strength on both sides. Nicely done. I'll check quad flexibility. This is our uninvolved side, of course. Normal flexibility of her quad. Is that sore at all?
A little bit, yeah.
So there's some resistance here for sure. A little click as well. Clicks on the outside part of her knee here. And a little bit of tension. So I'd say it looks like there might be a little quad tightness on the right versus the left. Yeah, for sure. Okay, why don't you go ahead and step down, please? And come on out here again, please. And will you do a squat, please? Okay. Try to stay on your right leg a little bit more if you can.
Okay, that hurt. But I'll do it again.
Try one more time.
Okay.
It's a little better. But still as sore?
Yeah.
Still sore. Will you put your right foot in front of the left, like you're going to do a lunge almost? Okay. And now take your left knee down to the floor. So a split squat. Is that sore?
It doesn't feel good, so yeah.
How does it compare to squatting?
Squatting was worse.
Squatting's worse, okay. Now bring your left foot forward, put your right knee back. And can you take your right knee to the floor?
And then it hurts.
That's sore?
Yeah.
No. Okay. All right. How about we face the back wall, please? You can use the wall for balance. So you walk into the wall, perfect. Will you show us a toe raise, please? Excellent, and then back down. And how about just on your right leg? And go ahead and lift up, and back down. Can I move your left foot out of the way? Okay, and do the same thing again, all the way up, and all the way down. And just for the sake of time, that is all the way up and down. Okay, will you face us? Stand on your right leg only. I'd like to check your balance. And now eyes closed. Okay, left leg please. Eyes open. And eyes closed. Good, and rest. Pause please. There are a couple more things from Brittany's examination that we still want to show. Brittany, will you lie on your left side? This will be a test for IT band tightness. If you remember, she had a kind of a click on the outside border of her knee when we were doing the prone knee flexion. This is called Ober's test, O-B-E-R, Ober's test. And so I need to stabilize her hip, and then I'm going to check for IT band tightness. If I stabilize her hip, you can see that her leg does not fall to the table. A normal test would be the leg would fall all the way to the table. If I let her hip move, okay, then you can see she has plenty of flexibility there. So I have to, particularly on the young ladies, because they're so flexible through their hips, I have to hold onto her hip, okay, and then you can see it doesn't go all the way down. So that's IT band tightness. In the interest of time, let's assume that that's the same as the left side. Okay? Brittany, we step down to the floor. I'd like to do a squat again. So will you try to squat again, please? Okay. Come back up. So it looks like you're shifting away a little bit and bending a lot at your hips. Are you able to bend your knees anymore?
It's starting to hurt.
Still pretty sore.
Yeah.
Okay. Will you put your heels, so if you'll stand actually here, so your feet will be here and your heels will be on the board. And go ahead and squat again. Is that better?
It's a little better.
For you? So what that does is it gives her a bit of a heel lift, and then it kind of takes away any soleus tightness she might have. Okay, and then just to make sure, step away from and then try to squat again. Okay, and you can see her right foot out rolls in this position as well, and then back up. Okay, so it looks like some soleus tightness also limits her ability to squat. Hello gang, we're going to do the shoulder case now, the second of two cases for the